Hello and welcome. This is Dr. Rahul Kashyap. Welcome to our channel today. We have one of the medical students, Mr. Muresuk Mena, with us today. We are going to ask him to introduce himself and ask him what value he has for mentoring and see if you have any questions which we can answer today. Welcome, Muresuk.
Thank you, doctor. Yeah, just finished my second year medical school. So currently getting ready to prepare for step one. And as some of you know, if you've been there, or if you're getting ready to be there, it can be quite the journey. And so having a mentor, having someone to lean on, ask things to about to prepare for step is really important. To this point, I've realized that mentorship is very important. How you go about looking for mentors is definitely a unique skill that some of us can acquire early on really quick. Sometimes takes a little bit of time, but it's something we need, right? And so I guess my first question when it comes to mentorship is, when you are in medical school, how would you go about, finding mentors and the right mentors? And what does that relationship look like? And then if you're not in medical school and you're looking to get to medical school, how would you go about finding mentors that way as well?
Absolutely. I think that's a great question. And I will ask you your experience of mentoring and see why you're interested in. But let me share that mentoring is not only important during medical school. What I've talked to people and I emphasize on it, that you can start mentoring as early as possible. Start seeking mentors as early as possible. You can start in high school or in college, first year of medical school, second year of medical school, third year of medical school, fourth year of medical school, and so on and so forth. And at the time, people focus on the needs of their immediate needs at the time, but they don't realize if they seek the mentoring early, they will not only get benefited during that phase of their life, their career, but skills they develop during that mentor-mentee relationship, they can actually utilize the same skills to seek newer further mentors along their career. And I really want to emphasize this point because that applies to wide spectrum of listeners or learners today as well. It's never too late. If you didn't find a mentor in high school, college is a good time to find a mentor. If you didn't find a mentor in college, the first year medical school is a really good time. If not, second, third, and so on and so forth. You get the point. Now, is it the same mentor? Probably not, because the skill set of mentors are different, suitable for a different stage of career. Something which I always brag about it, and I'm really biased. Clinical research or medical research is something you can actually work through the same mentor or similar mentors for a longer spectrum, but ultimately your path's going to depart where you might want to do research into certain specialty, let's say cardiology or surgery or OBGYN or psychiatry and whatnot. And this one person you may or may not be working from the beginning may not have content expertise in those areas, but the basic principles of clinical research or medical research doesn't change, as well as the skills in mentoring doesn't change, especially the time commitment, the trust, the keeping yourself accountable as a mentee, as a mentor. Those things do not change. So I am amazingly biased about mentoring. I'm a pro mentor or mentoring, and I would suggest each and every person, not just in medical field, but especially in medical field, to seek out mentor. That is something I would like to suggest.
Okay. That's it's interesting you mentioned like mentoring from the perspective of thinking long term, because sometimes for me, I'm just thinking of finding a mentor that can help me here, right? So what I mean is, before medical school, every mentor I've had is how do I get to medical school? I've never thought about the long term game, but now that I'm here and entering approaching my third year, as you mentioned, okay, think more long term, fourth year residency, like have a long term plan. So I think my approach now is going to be trying to find folks that can help me with that, because it's tough. I know for me, I've struggled in medical school with like not trying or focusing too much just on the exam I have right in front of me and not always like the future, right? But I think the whole point of having a mentor that can help you see the long-term game is to set up steps moving forward, because it's a never-ending process. And I think it's very wise to look to the future. So when it comes to research then, let's say like for me, like I have an idea of a few things that I would love to like specialize in possibly. right? But I'm not quite sure what. So is it important to do research in a specific field that you want to get into, or how does that work?
That's a great question. So let me put it this way. Those who doesn't have any research experience or just starting, it does not matter. You want to start on a project. The reason is the basic principles are same in research. And we have many videos already uploaded on the channel here to talk about the basic principles, how to write a background section, how to come up with an abstract or primary aim or discussion sections. So starting early is better than starting focused. You want to start early with the mentors, anybody who's working in the same area, whatever you can get your hands on. And this is for resident, this is for medical students, fellows, and a junior faculty member. Start with a case report or review article. It doesn't require money, IRBs, or any other time-consuming pieces there. You can start quickly, shorter, and then do that. Once you do one or two of these things as a primary author, as a first author, then, and by the time either you're passed through, you have got your second, third year, fourth year medical school, or for second year of residency, now you start liking some of the rotations. You know that I want to go into this particular field. It could be GI, or it could be cardiology, or it could be psychiatry, OBGYN, surgery, anesthesia, whatever it could be. Then you can start seeking newer mentors who are content expert in those areas. It's very simple concept. You start to acquire some skills, you go with this little bit of skills, now you're going into content experts in those certain areas. Or sometimes it's hard, it's crazy to think that, oh my gosh, a second year medical school student would know that he's gonna or she's gonna be a cardiologist. That could not be possible multiple times, and people changes. So you can be smart about and picking up topics which can serve you multiple purposes. You can pick up a topic, just to give an example, let's say COVID-19. And if you're going in psychiatry and COVID-19 psychiatry, you can pick up mental health issues and well-being in COVID-19 among healthcare workers or among patients and so on and so forth. You don't know if you want to go into cardiology or nephrology, you can pick cardiorenal syndrome in critically ill patients. So that covers your intensive care as well. If you covered something like that surgical areas, you can pick up something in anesthesia or surgery, which can cover those things which you're not sure about it. So my point again is, start somewhere, learn the process, take the time with the process, get done with your first or second product, and then by the time either you already know which direction you want to go, at least you narrowed it down, that as a medical student or even high school kid or in residency, that I will be going into this direction. I'm going to surgical specialties or non-surgical specialties, or I'm going to medicine. So whatever you pick up in medicine, it'll help you even though you apply for different fellowships later on. Your point earlier that keeping an eye in future, that is applicable all the time. Of course, we have to take care of the immediate needs, what we have in our career, our personal life, but planning and investing our skill set towards an eye on future, it will always pay off. It takes away the anxiety because now you're expanding your time frame to get things done which you would otherwise do in a very shorter time frame.
Okay. Okay. So in that same breath, then, in terms of looking to the future, you don't hear too many people like pivoting and going into a different specialty. However, you do hear people maybe moving to a new facility or joining a new team. So with your experience in medicine and some of your colleagues you've talked about, how do you know is the right time to make that pivot? Whether it be going from one facility or one, company to another, or if someone does end up making a change to different specialty, which I don't know if that's possible, but what are kind of the gauges you've used to, I guess, like further seek if you're going to change opportunities or seek another opportunity out?
You're asking great questions, Muresuk. So change is hard. Change is absolutely, absolutely hard, but change is the only constant in the life. We all should be preparing it, and mentoring helps with that. It prepares you as you walk through or work through with one mentor or multiple mentors at the same time, or different mentors in a different stage of life. Change is something you move in the stages from your career. You move from one city to another one. You move through one institution or hospital to another hospital as well. Point is keeping an open eye, and the way the field is moving right now, where informatics, data science, machine learning, artificial intelligence, with administrative work, with a lot of physicians are having MBAs and MPH and PhDs and double doctorates and things like that. The field is moving faster. We will have to move along with the field. We have to have change, keeping a mind of change as well. Change management is another thing I would like to focus on as we go along, because that should become part of our parts and parcel. We see change in pace during medical school residency and fellowship, and you move from one rotation to another one. That's the biggest example. Some specialties or some rotation starts very early in the morning and they keep going till the late time, or during your ICU rotations where 12 hours shift from 7 a.m. to 7 p.m. or 8 a.m. to 8 p.m. compared to your outpatient skills, inpatient rotations. So that, I think medical school prepares us well for those changes within the same environment. But because we see ourselves as a student, we don't realize that this kind of change will occur in practice and shift changes and other things as we go along for residency, fellowship, and other city or state or country changes happening, especially many of our friends from international medical graduates, they make a big change of coming to United States for their clinical training. In a bigger picture, as people go through fellowships and residencies, and then even some of them, they apply for permanent residency, green card process, and so on and so forth, this change is inevitable. It's going to happen. Equipping yourself with good change management tools, having patience, investing time into your own skill set is the only key I've known what successful people have done.
Okay. Change is only constant. So with that, then this is man. So with change being the only constant, you keeping up, I'm assuming it can get exhausting. So a question I have to ask is, how do you avoid that exhaustion? How do you avoid that burnout? Because if I'm always trying to keep up, not only in my career to make sure I'm knowledgeable about medicine, for myself, for my patients, how to keep yourself from getting to a point where you are burnt out. Because a few articles I've seen recently, there's been a lot more healthcare providers, particularly nurses, talking about the effects of COVID, but also leading to like a lot more burnout. So, how do we not get to that point? Because, a lot of us that get in this field want to serve, want to help, but sometimes we burn the candle too quick, if you will. So how would you advise that on that?
Well, the burnout is real. There is no question about it. It's real in any field. It's real, especially in medical field. And at the time of recording of this video, as we're doing it in the middle of the pandemic, burnout among healthcare providers, among our colleagues, it's a real concern. It should be taken completely seriously. The question comes in how you prevent it. I don't know. If I would know the answer, we would have solved this problem. But there are a few things which people have deployed, which may have helped them prevent the burnout. One is the kind and compassion, care, creating a support group around you, personally, family-wise, and as group of your colleagues is the first step I would suggest. Having that group of caring people around you who you can lean on support. Two, speak up when things are happening with you or with one of your colleagues, rather than bottling them down or ignoring them. That's never a good idea. Speaking up, letting it out, and taking wellness breaks, such as time allows, or you can seek out and work with your supervisors and managers to schedule your wellness breaks. It could be a few hours during the shift. It could be a few days within a week, or it could be a few weeks based on what you need to just completely off from the work environment, to recharge, to heal yourself, not for a physical trauma, but the mental trauma, the burden of all sickness going on around us during peacetime, during pandemic time. So those are the two things. And third thing I would suggest is that once knowing our own limitations, if we like certain kind of work and then we become passionate about it, then chances of burnout goes down as well. But even though with enough kindness, enough compassion, enough passion, given the pandemic circumstances, and it has taught us really well that sometimes it's just us to withdraw from the situation, which is either thought out plan, or if you have to do it on an urgent basis, I think it is required and then that is good for the long-term well-being of ourselves, our patients, our colleagues, and family members. There's juries is still out, the research is still going on. We're working on some of these things by ourselves to see what is the burden of burnout among healthcare providers, among patients, in general population during pandemic. And I think there'll be a few more years before we find out what the some triggers and what is the some suggestions from the research coming out which can help us with the burnout.
Okay, okay. Hopefully find that soon, because I mean, year two is definitely tough for med school, and I could definitely feel it towards the end. But yeah, like you said, having a good group of people around you is important, and taking a step away. I think that's tough for a lot of my colleagues and myself at times to step away from the studies, because we know that, we think, I should say, that the more time you step away, the less you're learning, and then that kind of creates this anxiety you might feel. But in reality, you do need that time away because you need to recharge. But yeah,
Yeah, go ahead.
I'm just hoping, there's a formula at some point, or at least a foundation, because it'd be nice to be able to recover, because it can be a long journey at times, as you know.
Absolutely. I think you're all right on bank. But thank you so much for joining us today, and our viewers for listening into it. We'll bring you back as well. And then please like and subscribe to our channel, and let us know in our comments how much you like this one and what are the topics you want to bring it to us. So with that, I would like to end this today. Thank you so much for your time.